started work in the Center for Excellence for Children's Care and Protection. And this is another really interesting study that looks at children's hearings and how the children's hearings have been done through video technology, so virtual hearings, and quite a lot of individuals involved in the project. So I look forward to hearing about it. Robert, I know I remember you said you wanted to do this work, so really keen to hear how it's developed. So over to you.
Thanks very much. And thanks very much to Jeff as well for that really interesting presentation and very thought-provoking. I'd like to talk to you a little bit about a rapid consultation that I was part of conducting last year into the use of remote children's hearings. And this was a collaboration between CELCIS and CYCJ, both in the school. And as you can see, there were a number of people involved while I'm giving the presentation. This is very much a collaborative effort, including Fiona Mitchell, Frank Gill, and Emma Young, and Nina Baswani. And I think some people are probably in the audience here just now. So through this presentation, I'd like to give you a little bit of information about the context at the time. As I'm sure you'll remember, it was a difficult period. Then talk about a little bit about what we did, some of our findings, and then briefly think about, well, what does that mean going forwards, given how things are likely to progress into the future. So as you'll remember, in the at the very first lockdown back in March 2020, it came as something of a surprise to a large number of people, a large number of organizations. And so on the 23rd of March, that lockdown came into place, and immediately face-to-face hearings were ceased because there was the stay-at-home orders and everything was closed down. And at this point, the children's hearing system in general, so that's a whole range of partners, worked really, really fast to try and get a virtual platform online and operational that would allow children's hearings to continue to take place. And for those who don't know, children's hearings are essentially the primary decision-making forum for children and young people in Scotland who are in need of care and protection or have committed offences. They are all dealt with by the children's hearings. And so in response to the lockdown and the challenges that presented, there was a piece of legislation was put through Parliament called the Coronavirus Scotland Act 2020, and that came into force on the 7th of April. And that relaxed a number of the procedural requirements around hearings, which facilitated their running, including relaxing the need for the child to attend, unless they were specifically told they had to, extending the operational life of compulsory supervision orders from the standard 12 months to 18 months, and things like that in order to facilitate the process and in understanding how difficult that situation was. But between the 23rd of March and the 20th of April, there were no face-to-face hearings, and that extended through till July. There were no face-to-face hearings at all. All hearings took place virtually. Initially, these were just in the most severe cases where there was an immediate risk to the child, and there the reporter, essentially the administration of the hearing and the panel only would attend. But by the 20th of April, so really very rapidly, under a month, they had full hearings with panel, with children, families, other professionals, all able to enter. And the hearing system and partner organizations continue to take a very much an improvement approach to this. So they instigated a program of a way of working through these virtual hearings, and then they worked to continue to improve that. And in that light, they really welcomed the research that we were doing, and they facilitated that extensively. And we're really keen to see the outcomes of that, and in order to continue to improve and to learn what was happening. So what we did was we conducted a very rapid consultation with a range of stakeholders, essentially anybody who had experience of or had wanted to take part in a virtual hearing. So virtual hearings, remote hearings are kind of used interchangeably in this context. Those stakeholders included children and young people, parents, carers, social workers. You can see the list there. We did want to include children under the age of 12, but unfortunately, given the speed that we were trying to put this in place, we weren't able to. We would not have been able to do that in a way that appropriately supported their involvement and made sure that they were protected from any negative emotions that might have arisen out of that. So unfortunately, we were limited to children aged 12 and above. We also facilitated, this took place predominantly online through Qualtrics, but we also facilitated through television, through telephone. And the open time was for 2 weeks between the 15th and 28th of June last year, 2020. And we gathered over 270 responses. So a large number of responses. We were really pleased with the response rate from all of those roles represented there. Just to be really clear, we asked for responses to a number of questions in and around experiences of virtual hearings. And that's what we're reporting on. We didn't do any further checking, if you like, to check the veracity of claims that might have been made, but predominantly what we focus on is people's experiences and their subjective experiences of that and how that's impacted on their ability to take part. So now to talk about some of the findings that we came across. So the first and most predominant finding really was around the technological challenges that people were experiencing. So these related to all aspects of technology, so hardware, software, connectivity, and also the usability. So the hearing system had introduced two pieces of software which facilitated virtual hearings. One was vScene, which is a virtual conferencing platform, and the other was Objective Connect, which is a confidential information repository. And so these were used to store the papers which are distributed to hearings, which all participants should be able to, well, the majority of participants should be able to see. And vScene was the way that people actually met, the equivalent to Zoom or Teams. And these are both very secure platforms, which is why they were chosen. Absolutely secure, but that had some difficulties or caused some difficulty in relation to people actually engaging and actually being able to log on. So there were some difficulties with people not having hardware. There were difficulties that people had in terms of actually using the software. So logging in, people reporting that they were being dropped out of conversations and unpredictably, that they were unable to hear the audio through the software. Also, we had a number of reports of connectivity issues, which are hard to attribute to where they came down to, but those broken up audio or video, difficulty hearing people, low audio levels, things like that. And just fundamentally, the usability of the programs, people found them reported that they'd found it had quite some difficulty, and that was particularly also in relation to Objective Connect in terms of accessing those papers. And we'll talk a little bit more about that in the next couple of slides. But overall, these really impacted on people's preparation for hearings and their ability to take part. So both reading the papers in order to gain a full suite of information about what was happening, their ability to take part in terms of actually attending the hearing, being able to hear what was going on, and also their emotions and their responses to that, because they were perhaps more stressed because they couldn't hear what was going on, or were having trouble making themselves heard. And it's important to note that throughout actually all these findings, these were found across the respondents, the respondent group. So there were really very little that wasn't highlighted across those groups. So reporters, panel members, safeguarders, social workers, parents, and carers all reported the same kind of issues. So we're very confident that these are things which were experienced across the piece. But technological challenges were really prevalent. It's important to remember that this was really early days. This was 2 months after the initial lockdown. And the hearing system was going through a process of continual improvement and training for panel members, for families, for children, in order to in how to use these programs. But it was a really challenging environment and really difficult for some people. And it also linked into things around digital poverty and the digital divide. So people often reporting that some people had to share devices, for example, perhaps only having a mobile phone that was able to access the software and go online, not having the data packages to enable effective communication through video conferencing. All these things were brought up and were concerns for people. And these are things that the hearing system worked to overcome. So they began distributing computers and data packages, but they were really significant challenges to people taking part, especially in those early days. There were also significant challenges reported in relation to actual participation. And that's obviously one of the key aspects of the children's hearing system, is that it's supposed to be an open, collaborative discussion between all parties, all the people who have an interest, in order to find the best care plan for that child or young person. And so participation is really a key element, it's really a cornerstone of the hearing system. And immediately, one of the things that people highlighted was that there was a perception that there were fewer people attending. Now, we don't have actual figures on that, but from what people said, from what panel members and social workers and the like said, there was a report that fewer children were attending their hearings. And that, of course, was facilitated by that legislation, which relaxed there's normally a requirement for them to attend under law, and that was relaxed in these circumstances, so they were not required. So that could be the simple cause of that. But certainly there appear to have been fewer people there, and obviously fewer children and young people there. And obviously, if there are fewer children and young people, then they are less able to take part in their hearing inherently by not being present there. In relation to participation, there was felt to be a change of tone in the hearings. So where they were normally more open discussion between all the parties present, it developed a bit more of a turn-taking type approach and a more formalized approach to the hearings, which many people felt was to the detriment of the discussion and to finding the appropriate decision. But equally, actually, some people reported that they felt that was an improvement. They felt that additional structure was a way that enabled people to actually participate a bit more equally and consistently, as opposed to the discussion where perhaps some people might be able to dominate. In relation to communication, I've already talked a little bit about those connection and audio-visual problems, and that was a significant challenge, and that impacted clearly on people's ability to communicate inside those hearings. But there was also a bit about the challenge of how to understand the dynamics of that hearing and when you are entitled to speak, when you should be speaking, how you make it known that you want to speak. These were all challenges to the communication, as well as things like delays. We're all probably quite familiar now with virtual conferencing, that there can be quite a little bit of a delay between somebody actually speaking and that occurring, and the way that can cause people to speak over one another accidentally. And all these things make that communication a little bit more difficult, and inherently limit that or make participation more challenging. And then finally, there was also that in relation to participation, a clear indications that there was it was really difficult to have effective representation in virtual hearings. So one of the key roles of solicitors and people who come along to support people in hearings is to help people participate by being there with them. And of course, virtually, they're not there with them. They're not able to have little conversations in their ears. One of the things from previous research we know is that solicitors have a large role in actually managing parental behavior, particularly in terms of managing emotions, helping them to put forward their points really clearly, helping them to present their case and their views effectively. And solicitors and advocates and people in those roles reported that was much more difficult via virtual technologies, because they weren't next to that person and they didn't have private means of communication through the software that was being used. They were not able to communicate privately with their client, and that made it much more difficult for them to enact their role and to actually represent people clearly. There's a number of quotes here, and there are on future slides. I'm not going to read them out. They're just there to give you a flavor of the kind of things that were reported. I'll talk more about how they were reported in general. So one of the other key areas that we found around our findings was around the information and that flow of information. So one of the key roles, key ways that information is shared in hearings is through those papers. And I talked about Objective Connect, the program, the software that allow people to access hearings papers confidentially and online. And many people reported that they had significant difficulties either logging into that or in using that. And they found that it was very time consuming and very difficult to navigate. And then they also reported that one of the challenges around the virtual environment was that because it was separate from the video conferencing software, they weren't able to reference those papers at the same time as take part in the video conferencing software, because they were using their device to video conference, and they didn't have another device to look at the papers at the same time. And also that because they were digital, they were inherently just more difficult to reference. So they were not able to print them out, and it made it more difficult for them to deal with those papers and to prepare appropriately for a hearing. And that, of course, is really, really critical. That information is information which should be shared amongst the whole group, social work reports and the like, in order that everybody understands what information these decisions are being made on. As for, again, there's technological difficulties, the audio-visual difficulties, excuse me, really impacted on the ability for people to share and to receive that core information. So alongside those things, like I've said about how do you actually physically hear the words or the statements that are being made? Can you actually access those paper? Are you connected? If you're dropped out, obviously you're not hearing anything or seeing anything. But even where there is a perfect connection, about well, how do you make it known to the chairing member or to the group in general that you want to speak? How do you interject? How do you indicate that there's something that you want to say without appearing aggressive by talking over somebody or just starting to talk? That bit was really much more difficult. And also, people found that without being able to see people who were speaking, it was much more difficult to understand what was being said, and to understand the kind of emotional context and the information that is being imparted that way. And that's there in seeing other people take part. What we heard repeatedly was that facial interaction, body language, expressions, the way people interact with one another. People report that that's really, really important information in that hearing. So in a hearing, normally you obviously get to see that. You get to see how a person reacts to somebody saying something. You get to see how two people interact. You get to see how information is landing with people, whether they are understanding properly, whether they want to speak, and that a huge amount of that is just stripped out by virtue of it being through virtual technologies. At the moment, I can't see how you are responding to me talking because I can see, or you can see the big screen. And so I'm not able to see whether I should perhaps be expanding on a point to make it clearer, or perhaps that everybody understands this and wants me to move on immediately. And in a hearing, it's even more important that reaction, how people are dealing with this often sensitive information that's being talked about, is really, really important information. And that is too often being lost by limited numbers of people being visible at any one time, only being able to see from the head up. So not really being able to see full body language and how relaxed or how tense somebody is looking. All that stuff was highlighted repeatedly as really, really important. And then also in relation to information, there were issues around confidentiality. Obviously, hearings deal with really sensitive information that is a huge volume of it is entirely confidential. And that people highlighted that there were issues with confidentiality in that home environment. And that relates to some of the things I talked about earlier, including that digital poverty, where if people are sharing a device, it is pretty much impossible for only one of them to hear that information. But also, if you're in a room, if somebody is participating from their own home, it's really not possible to control that environment and know for sure who else is there. We can ask people to do it in a private room. We can ask them to make sure that nobody else can overhear, but we can't expect people to have an individual room that they can all go to separate from each other. Inevitably, people can overhear each other through walls, and there is the possibility for that information to be leaking out. And that was a concern, both within families, but also where panel members are working, perhaps where reporters are working. These are all really important. And one of them there is a really good example in that quote there, someone saying, well, we didn't even realize there was someone in that room until they started talking in the background, and only then did they realize there was a person in the hearing that they didn't know about. And so there was real potential there for confidential information to be leaked beyond who was entitled to hear it. And that's really, obviously a really critical part, and starts to speak about the the confidence and trust that people will have in talking in these environments. So it wasn't all doom and gloom. Many people highlighted that there were also benefits to the virtual hearings. The first thing and most common thing that literally every group said repeatedly, we saw repeatedly in the comments, was that it was just really important that hearings continued to be held, that they make really important decisions in the lives of children and young people who are often in very vulnerable situations, and that it was really critical that those decisions were able to be made and that these panels were able to continue. And that was just above and beyond, that was the most important thing. On the next slide, I'll just show you the weight of that sentiment, if you like. So that was the first thing. It was just virtual hearings were better than no hearings, absolutely. Another thing was around that home environment, that whilst there are some concerns around that or things that we need to be careful about, that might also actually facilitate participation as well and make children, young people, families more relaxed and more inclined to attend and to participate if they can take part from their own homes, rather than going into a formal environment where they might feel less comfortable. They can perhaps be more relaxed in a more comfortable chair in an environment that they recognize and have perhaps supports closer to hand. There's also the benefit of access, that virtual hearings don't require everybody to be in one room. So people who live a very long way away are able to attend as easily as someone who lives next door, that they can facilitate the participation of a large number of people very easily. And also that they limit the time between traveling. So for instance, social workers and other professionals would say, well, yeah, now I don't have to travel between all these different meetings. It's actually much quicker and much more efficient for me to be able to attend these meetings, and they save a lot of time in that way. And also that perhaps engaging virtually might be just more manageable, might be easier. And this was particularly thought in relation to children and young people. Some people highlighted that they felt that children and young people might be more familiar with virtual engagement and taking part in online forums, and thus much more comfortable in that setting and able to contribute more. And so here's just a table to highlight the value that was placed on continuing hearings. We asked specifically, we knew that there were obviously changes and that it was a difficult scenario. So we asked, do you consider that this way of working, virtual hearings, was justifiable in the light of the lockdown or social distancing measures? And you can see that across all the roles, there's a huge majority say yes, it was absolutely. There are difficulties, and they, as I say, these difficulties were represented across the groups. There are difficulties and it's not ideal, but this is far better and it was warranted, and it's far better than not having hearings at all. And I think that's important to keep a hold of as well. So this, as I say, this data was collected in June, and so there's been a long time since then, or 6 months, say, well, more like 9 months now. So through this time, the hearings have continued to improve and develop. So the Children's Hearings COVID Recovery Group has been meeting weekly, and that represents the main stakeholders, and they coordinate and they try and work out, well, how can we continue to improve those the experiences of hearings? They accepted our, like I say, they welcomed our research, they accepted our recommendations and have been acting on them. So they've been improving those software packages, so that, for instance, now there is the possibility to have communication between clients, solicitors and clients, for instance. That would be one of the things. In July 2020, July last year, of course, there was a return to face-to-face hearings after when the lockdown was eased. And obviously it was hoped that that would continue through, but unfortunately in January this year, almost all hearings are returned to online. A very small number of hearings are being held face-to-face with social distancing, but not, very, very few. And also now there is increasing attention being paid to blended hearings. So hearings where some people are in person and some people are taking part virtually. And I think that's where we can find our continue to improve things. And there's been continued training and support. So looking forward, the return of face-to-face hearings will hopefully come very soon, perhaps in April, but minority will continue to be online and blended. And there's likely to be a large number of hearings which are waiting to take part. So really coming from here, it's about, well, how can we maximize those benefits and minimize the challenges? So how can we promote legal and other representation support in these environments? How are participants supported to take part in hearings? How are they supported emotionally and practically during and after the hearing? And when we start thinking about blended hearings, how can equality of participation and access be assured between those attending face-to-face and those attending virtually? And that's a really difficult thing to understand. And linked to that, a really crucial question: who gets to attend in person and who attends virtually, and what are the power balances that come with that? And I think these are the issues that really we need to start addressing directly as we move forward into a blended hearings or more virtual hearings taking place. So all the reports are available online to these links. I'm sure the slides will be shared so you'll be able to access them. And yeah, I welcome questions, and thank you very much for listening.
Thank you, Robert, and well done.